Doctors, what do patients do that annoy you? I don't like when a patient gets a full workup and their lab work and imaging is completely normal and the patient gets enraged. They don't know what's wrong with me. I'm going to XYZ hospital instead. When they literally can't understand how they are harming themselves. For example, my mom once said that a woman who smoked while pregnant couldn't accept that she was harming the baby. The conversation went something like this. The baby is underdeveloped for its age due to you smoking. So she's sick? In a way, yes. So when will I get some antibiotics for my baby? It doesn't work that way, ma'am. You're making her sick by smoking. But aside from that, she's fine, right? And so on and so on. When a patient is admitted and on their second day, they say, "Hey doc, I feel better now. Can I go home?" Yeah, no, you go home when I say you go home, because feeling better does not mean you are 100% well. Technically, patients can leave whenever they want, but if you want to be discharged with the minimum risk of ending right back in the ER, please listen to your doctor. We don't want you to stay any longer than what's needed, trust us. So even if you say, "Can I go home?" in a joking manner, the fake laugh and strange smile of the doctor in response is proof enough that we've heard that so many times before, and we'd like you to stop. As an American, complain about pain. In the gosh darn awesome US of A, we fix things. Everything. It's this ethos that also permeates into how Americans deal with issues of their health. It is completely unacceptable to be in pain at any point in time. Placing IVs to deliver medication has to get local anesthetic. Simple wrist fracture gets diluted IV, one of the most potent IV pain meds available, in addition to local anesthetic and an oral pain medication. Immediately post-op from lumbar spinal fusion, why does my back hurt? After being in a car accident while driving drunk and only sustaining a tibial fracture and just had it fixed? Doc, I'm just in too much pain to leave. Sitting comfortably in bed eating delivery surrounded by friends reeking of weed. You know, I get it might be annoying, but sometimes when people are just openly complaining about things, it is kind of therapeutic. It makes them feel better. Not a doctor, but an ER scribe. Patients that mumble and patients that can't give a coherent history. Also, when a patient rates their pain as a 10 out of 10 in Triage, but they're chilling and playing games on their phone when we go to see them. On one hand, there's probably not much else to do when you're in the ER. On the other hand, I do hate it as well when people are just obsessed with their phones. I would probably rather it if they were playing on a Nintendo Switch or something. Like, the thing I hate about it most is when someone is just scrolling through Instagram or Facebook or what have you for like, I don't know, an hour while having a conversation with them, and then they're like, "Oh, you get on my case for it, but you do it too." It's like, no, I'm actually communicating with someone on the other side of this thing. My friend's dad is a doctor who works in the ER. He complains daily about how he wishes he wouldn't save most of these drunk, overweight morons who don't contribute anything to society, and complains about how he feels bad for doing his job, which is actively working against Mother Nature's careful elimination of the unfit. I think maybe it would be in your friend's father's best interest if he got a different job. I've worked in an ER for the last 4 years. I work very closely with many doctors. When I come into the ER, anything that isn't life-threatening because your doctor can't see you, you're a moron and waited till the last minute. You have crap insurance that no one but an ER will take, but you don't have primary care doctor, etc., etc., etc. Are we going to see you? Yes. Are we going to be polite and professional? Yes. Does the hospital business model exist assuming that there will be so many thousands of clinic-type patients in the ER? Yes. But goddammit, are we going to be annoyed that you are taking precious time away from sick patients, delaying triage and rooming time for sick patients, or just annoyed at you in general? Yes. Good rule of thumb. If your problem can wait till tomorrow, it does not belong in an ER. I've actually witnessed that. I think it was this like Muslim lady or something, like a hijab and stuff, and she came into like the A&E and she seemed fine, and she just kind of came up to the desk when there's people like bleeding with like really bad stuff going on with them and goes, "My finger hurt." And I kid you not, this little girl like a twisted up arm who was crying a moment ago like stopped and like looked at this woman like, "You don't belong here, honey." Not a doctor, but my brother is. He tells me he gets very annoyed by most of his diabetes patients. Many of them never take care of their health. They drink soda and eat BS all the time, and they do not exercise. Of course, they get really surprised when they see their sugar test results. "I'm sorry, doctor, but I love chocolate so much." My mother is a nurse, so she has a full list. First off, she hates people who sue. She hates them because 90% of the time, the doctor is doing their best, and it would be ridiculous to sue. But then they turn around and straight up sue the doctors. This causes the doctors to have to run a bunch of unnecessary tests, which not only waste yours and the doctor's time, but it ramps up your hospital bill. This in turn causes the lower class stress, because then they can't afford going to the hospital. If everyone just agreed to not sue, then the hospital bills would be much more affordable, which would make everybody, except the buttholes who sue, happier. Her second hated thing is the mean homeless drunks who come in because they have nowhere else to go, and then they are spitting and trying to fight the nurses because they are so messed up on God knows what. I'm just going to say I have no idea how accurate any of this is. In America, is it like a common thing for people to threaten to sue their doctors? I'm an oral and maxillofacial surgeon. Patients who start crying make me feel as if they're my victims, even though I'm on their side. From my father, ER repeat visitors with new objects stuck in their butt, and from my sister, an NICU nurse, parents that don't come in for newborn bonding time. ER nurse here. I hate when patients tell me the diagnosis that they think they have instead of their symptoms. Might as well Google the meds for it and go straight to asking the pharmacist for them and bypass emergency, dude. In so much pain, constantly asking for more painkillers. On physical examination, shouts out when touched and unable to do much movement. Miraculously manages to heal completely to get up and go out for a cigarette break on the hour every hour. Let's be honest, people that smoke cigarettes can be the most annoying people in just about every setting, especially work. I used to do laboring, and I remember we got this one really freaking fat guy come in one time for the job. Only stayed a day. I'm having trouble carrying a load, and I ask him for some help, and he just goes to me, "Oh, I'm going for my cigarette break." It was like, you had one like 20 minutes ago. It's like, "Yeah, I'm going for another." "Well, can you help me with this while we're going down together?" And he's like, "No, I'm on my break." I hate working with people who smoke. Comes in for a cold. "I know my body. Antibiotics are the only thing that helps. I need an antibiotic and I'm not leaving until I get one." Okay, I admittedly did this once with my dentist because they were like, "I'm going to pull your wisdom teeth out because they're giving you abscesses." And I said, "Well, you're going to keep on giving me antibiotics because I'm not going to let you pull my wisdom teeth out." And I feel like I was kind of right to do that in all honesty, because like they haven't given me an abscess ever since. Not going to dialysis because you don't feel well. Usually the cause of not feeling well is because you skipped your last dialysis appointment, Karen. There was no mention of a Karen, I just thought it sounded funnier that way. This happens all the time. Do you have any pre-existing conditions? No, I'm very, very healthy. Do you take any medication? Oh, yes, I take this for my blood pressure, this for my blood sugar, this for my MI heart, this for my thyroid, etc., etc., etc. If you want a professional to listen to all of your personal problems, go to an office with a psychotherapist, psychologist, psychiatrist, LCSW, or counselor on their sign and nothing else. Your podiatrist, dentist, or optometrist knows next to nothing about mental health and certainly isn't qualified to treat it. Neither is an otolaryngologist, a gynecologist, or a thoracic surgeon. Honestly, family physicians who have only the slightest training in mental health yet do the majority of prescribing of psychotropic medication in the US really are only a stopgap solution, and in best practice wouldn't be allowed to prescribe those meds at all. Ditto times 2 for psychiatric nurses and PAs. Could you tell that some of those words were making me slip up? Not a doctor, but a pharmacist, and I get this a lot. A patient comes in. "I have a 2-year-old with a runny nose, and I found this homeopathic remedy that doesn't actually have any medicine in it. Is this a good choice?" Well, there's no evidence to suggest that this product is effective, but this Claritin or Zyrtec is not only cheaper, it has real medicine in it that has been clinically proven to help manage allergy-type symptoms, including runny noses, and is labeled to be appropriate for children this young. No thanks, I'll just give him this other crap instead after wasting 10 minutes of your valuable time against your professional advice. As a psychologist, DNAs did not attend. I find it really difficult to do other work while waiting to see if my patient has come. All the prep and supervision time also feels wasteful, although they are part of the work because avoidance is hugely common in everything. My mother has worked as a biller for a doctor's office, gastroenterologist, for years. Some of the ones she comes home complaining about include, but not limited to, people telling her about their symptoms. She's not a doctor, please save this for him. Calling to complain about how much an office visit costs. Yes, even if it is $20, she does not control this. There is not anything she can do about it. Bringing in stool samples to show her. Yes, it really happens. That poor, poor woman. As a doctor, I really have to add in that a lot of these comments bother me. The last thing the big portion of these patients need is another reason to be scared of going to the doctor, or personal judgment from the doctor. If the patient came in with what you consider a low-level reason, take the time to educate. That is at least half the reason any patient is there, and they can appreciate it. Ask yourselves if you enjoy going for medical and dental visits yourself. I don't. It can be a vaguely embarrassing, invasive, humbling experience, though I do appreciate the value of being educated again of what it's like to be a patient. While I don't see it often, there is one thing that annoys me about patients, though. I wouldn't express it to them. Anyone who defends cigarette use as something more natural and relatively innocuous. I had the aunt of a pregnant teenage patient rhetorically ask me if quitting smoking would cause a shock for the baby and therefore be harmful for the pregnancy. It was clear from the tone that she thought the girl should continue to smoke. Another wanted only natural medications and vitamins during the pregnancy. No vaccines, fully natural childbirth with no cord cutting, all of which I am fine with for the record, but continued to smoke half PPD during the pregnancy. To all smoking, pregnant, and preconceptual patients, I say, for the grand majority of pregnancies, up to the point the child is born, you quitting smoking is more important than anything I can do as a doctor, and I will gladly help you in any way I can towards that goal. I think maybe many people needed to hear that right there, because at the end of the day, these people aren't here to judge you. Granted, they probably will, because that is definitely going to happen in all of these situations, but at the end of the day, they're really here to help us. Sorry, I'm not a doctor. I'm only a lowly optician, but we have patients too, and they make me so angry. So, when I spend time fixing their rimless glasses, I hand them back and they start bending them to check and see if they still wiggle, which makes them wiggle again. When they put on a brand new pair of glasses and they start moving them all around, up and down, right to side, and claim their vision seems weird. Well, yes, you aren't allowing your eyes to relax through the focal point. Put it on your face and focus on one thing at a time until your eyes submit to the refraction. People who have been in progressive lenses for years but buy a new pair and suddenly don't know how to use the lenses properly. I give them a reading card and they try to look through the top of their lens to see up close and then claim they can't see. Well, yeah, that part of the lens is only for seeing far away. Look down, please. Not patients, but doctors. Doctors who are too arrogant and egotistical to acknowledge that the RX they wrote doesn't work for the patient. I don't even blame the doctor for the RX being wrong. It could be wrong from the patient's blood pressure, eye pressure, cataracts they refuse to get removed, allergies, dry eye issues. Maybe the patient is just stupid and can't answer questions correctly, but the doctor should always allow the patient to come back and get retested if need be. Also, don't blame my glasses. I check my end to make sure we didn't mess up before we send them back over. It's usually doctors who have an optical in their office who have this issue. We're their competition. Maybe they're just stupid. That is surprisingly the answer for a lot of things. I know sometimes I'm just stupid. As an emergency medicine doctor, leaving against medical advice when they have something serious, I had a patient with a very large pneumothorax, collapsed lung. He insisted that he knew his body and had to leave so he could sell his car. Another patient had a STEMI, the more serious type of heart attacks, and left against medical advice from the ambulance. Even had the cardiologist talk to him on the phone, essentially saying, if you don't come to the hospital, you'll most certainly die, and still insists on not coming in. Smack overdose patients that act like jerks happen so often. Patients will be passed out, not breathing, vomits, has pneumonia in multiple lung lobes, on death's doorstep, but once you resuscitate them, all you get is a middle finger, literally get spit on, and sometimes they'll swing at you, screaming. Not all of them are this bad, but so many of them are. Non-emergent complaints. Our emergency departments get full to the brim with patients. Wait times are long, resources are low. Some patients clog up that system with non-emergent complaints. That should be dealt with in a clinic setting, not the emergency department. Medication refills or their specialist's appointment is too far away and they want to be seen by that specialist that day, or back pain they've had for 50 years that isn't any different today than usual. Overall, it's not bad though. A patient who's even a little appreciative goes a long way in making it feel worthwhile. Being able to actually reassure someone who was just scared over something small, or getting to make a positive impact on someone's life when they have something big, makes it feel worthwhile between a lot of jerks we encounter. My only thought on this is that some too many cases of people being low on their prescription might be an emergency because they might need it to live. I mean, what about drugs for diabetes? I'm pretty sure that's a thing where people need it, right? Med student here, but usually something along the lines of, are you a smoker? Nope. Have you ever smoked? Yes. How long were you smoking for? 2 packs a day for 50 years. When did you give up? 3 days ago. My partner is a doctor. She had 2 answers. First, the doorknob comment. Come for a 15-minute appointment, spend 14 minutes talking about a mild cough. Then, as she goes to leave the room, patient suddenly remembers, oh yeah, and my penis is green and smells strange. Second, having to write a medical certificate and letter for employers that require them if someone takes a day off because they're sick. Waste of everyone's time, in her opinion. Patient stated he has a cold, examined and determined that patient does indeed have a cold. Thanks for wasting my time. When they come in with non-evidence-based, unproven, and sometimes dangerous recommendations from their naturopaths, like broccoli juice cures cancer. According to my nurse girlfriend, when they bring their family member who has some medical training and that family member orders them around. Who? Who does that? Who? You've turned me into an owl. It's not their fault. But where I come from, we have to see 40 to 60 patients in an afternoon. Time is of the essence, and we have nearly 15 minutes to interview, figure out what they have, and tell them what could be done. Because of the time frame during the interview, we need objective answers, something patients avoid like hell. We ask when the pain started, and they say, well, I was at Mary's wedding when it started. I'm thinking, who's Mary? When was it? The 28th. Of which month? I have several other patients, and I don't mean to be rude with this, but I need answers. Come to me and ask me what they could potentially have and then interrupt me because their Google PhD knows better, I guess. Animal doctor here. I hate when clients bring in their pets for a sick exam and decline all diagnostics and treatments. It's one thing if they're financially in a rough spot. I try to help them out as much as I can, but it's another when they say things like, I just don't believe in medicine, or I can fix this with coconut oil, turmeric, essential oils, crystals, and I don't trust any of your advice. I feel like I've done nothing to help their little friend, and I worry about their pet all day. Bonus anger when they want to pay for a toenail trim for $20, and the medicine they've declined is cheaper than that. I've even gotten no's when I try to give them a free trim so that I could send home meds. Not a real doctor, but a dentist here. There are a few things that irk me, but I do realize that people really do not want to come to the dentist, so I try my best to ignore most of it. So the only thing I'll say, without trying to toot my dentist horn here, is that believe it or not, a lot of the things we do in dentistry on a day-to-day basis are actually pretty difficult technically. The fact that we do it so often that it becomes routine does not change that. I realize that patients have no idea what I am doing in their mouth for the most part, but believe me when I say that mistakes within fractions of a millimeter can mean the difference between an amazing result and a catastrophic failure. As such, when patients have either a bad attitude or are not interested in trying to help me, it adds a huge degree of difficulty to something that is already hard enough. People who don't open wide on purpose, even after being asked, or keep trying to sit up and want to rinse constantly, or ones that try to grab my hand when I'm giving an injection or drilling. I'm not asking you to do or not do certain things solely for my own good, it's actually for your own good, so that I can achieve a great result for you and your dental work. And also so that I don't accidentally bury my drill into the side of your tongue or the floor of your mouth while you are squirming around. I've never had a bad time at the dentist, except for the previously stated time where they were like, I'm going to take your wisdom tooth out. I'm like, haha, no you're not. And to expand on that, the only reason I was getting abscesses where my wisdom tooth was is because it was coming in. Now that it's like fully grown in there, it doesn't do anything now. I'd say the general belief many patients have nowadays, that pain is never okay. That being sick and feeling like crap while your body heals is unacceptable. You broke your ankle. I can do lots of things to help you heal and be in less pain, but it's going to hurt. Being pain-free is impossible. You have the flu, you're going to feel like complete butt for 5 to 7 days. Feverish, achy, weak, coughing. Frankly, unless you're seriously ill, you shouldn't be contaminating your community and my waiting room. Go to bed, take Tylenol, ibuprofen, fluids, and wait. But it's not fair. We're in 2020 goddamn 4. Why don't we have flying cars or hoverboards or pills that just make us better already? I want robot arms. I want robot legs. I want to live in a cyberpunk dystopian future. God damn it. I feel like every generation has that. Like my mom's like, we were promised Back to the Future 2015, you know, hoverboards and everything, and now it's like, where's cyberpunk? When's that gonna happen? Not a doctor, but my mother is, so I heard all the stories while growing up. Here are a few things that annoy her. Arriving late to your appointment. If you arrive late and she's already behind and seeing the patient after you, she may ask you to reschedule if it's not an emergency. If you know you're going to be late, call in and let them know. It might save you a trip if the doctor is already behind behind, or they could tell you to come in anyway. If it's your first appointment, try to arrive at least 15 minutes early. There is going to be paperwork. It's obvious when people come in just looking to score some opiates or pain medication. It's sad and she wants to help, but most or all of those people are just looking to score some drugs, not get help. If for some reason you do not want a female doctor, you should tell the scheduling people when you make your appointment. It's happened a few times where a man would come in and not allow her to touch him due to religious restrictions. You just waste everyone's time with that. Don't just stop taking your meds because you start to feel better. Oftentimes the meds are what makes you feel better, so if you stop them, you will be back to square one. Some medications need to be tapered down so it can be dangerous to go cold turkey. If you do not speak English or are calling in for someone who does not know English, please let the staff know when they schedule the appointment. The clinic is required to pay for an interpreter for you. If they show up and cannot communicate, there is not much that can be done. If this is the case, please show up because they have to pay the interpreter even if you don't show up. Pay your bills. The billing department will work with you. If you have a certain number of unpaid bills, you will not be seen. Some guy once hired one of those services that claim to reduce your medical bills by negotiating for you. That sort of thing only really works with hospitals when you don't have recurring visits. The hospital might settle for getting a lower amount rather than getting even less by selling it to a collection agency. But a clinic that you have to go back and forth to every 6 months or so will just fire you as a patient. Don't be a prick. The doctors and nurses are doing their best to help you and deserve respect. They do not have to see you, so don't go treating them like some minimum wage cashier. You should also treat cashiers with respect. Don't try and walk all over them. My mother has 5 patients who were repeatedly rude to the front end and phone personnel. There is a section in your account where the staff can put notes for everyone to see when they pull up your billing info. If you're a prick to them, it will show up there, and you will find everyone much less accommodating. When you subscribe, make sure to hit the bell to turn on notifications. Put the playlist on in the background to finish listening to all the stories. And if you like Am I the Genius, give Am I the Jerk a shot. Linked in the description below.